So welcome to the second part of fundamentals of research. And just to do a recap of what we covered last month, we basically defined what research was and why we conduct research and the importance of it. We talked very quickly about what the research steps are, what the basic research steps are, and how to develop a protocol. We also talked a bit about research question development and the importance of developing an interesting and worthwhile question. And I also sent you out a paper to read on how you can develop a question. And that protocol can be used either if you're developing a quantitative or qualitative research question. We talked a bit about research designs, and we specifically talked about qualitative research methods. And the methods we covered were interviews, focus groups, and observations. And the reason why we covered these particular ones is because those are the major ones that we tend to use in qualitative research. Other people use other methods as well, but these are the key ones, and that's why I covered those specifically. And we also talked about what their strengths and weaknesses are, because every method has a strength but also a weakness that we must be aware of. And then we briefly talked about qualitative analysis, and I gave you papers that you can read in detail later on if you want to get more understanding about qualitative analysis in general. So today we will talk about types of quantitative research approaches in general. In terms of methods, I'll only talk about a survey and what a survey is, what it is, and what its strength and weakness is. We will talk very quickly about quantitative sampling and analysis. And then after we've covered the quantitative methods and analysis, we'll talk in general about data management, communication, ethics, budgeting, and the importance of remembering all the items that we must budget for, including in-kind costs. We'll talk very quickly about potential funding resources and the importance of developing a research team and including as key people into your research teams when you're working as part of a group. So some of you may have come across this triangle, and basically what this triangle is, it's for quantitative research approaches. It's basically a triangle trying to emphasize what the key type of quantitative research approaches are out there, but because in the formation of a triangle indicating that the ones on top are in terms of research approaches are the ones that are considered high quality sources of evidence, and the ones at the bottom are considered not as high quality sources of information in quantitative research studies. And we shall go in a bit of in-depth in each of these type of studies. I've just provided this, I found this on the internet, and it's an interesting way to look at the other triangle which I've just showed you. And in this case, what they've done, they've collapsed the triangle in a corner, having again the case reports up to the meta-analysis, and that is what you see on your left-hand side. But what they've done is to, as you see in the burgundy color, those are studies. In the blue color, those are syntheses, and then continuing up that bigger triangle, you have synopses, summaries, and systems. So for example, under summaries and what is in the purple color, we have what we call practice guidelines. So people can go and do their studies, for example, in the burgundy color, but what you expect over time is that all those studies will be collapsed into systematic reviews, and I'll talk about that in a moment. But ultimately, if you want people to, when they're working out in the field, many of them will not be able to come across systematic reviews of individual studies. So what we do for a lot of clinicians is to produce summaries, or what we call clinical practice guidelines. And that's what a lot of us use in our practice in the field. So that's how we go from studies up to summaries or practice guidelines. So starting more or less at the bottom, case reports are a form of study, a quantitative study. However, they're considered weak studies, and though people do them, they're considered weak studies because it's difficult to generalize the results. Many of them just use a descriptive design, and you, for example, may want to describe a case study of disease, or in our case, you may want to describe a case study, for example, of a health service. And usually you do not have a comparison group, and the studies may be used to just, for example, to generate a hypothesis. So for example, one may be interested in looking, Annie, for example, you may be interested in looking at a case study of your health service in particular, and you study it in depth, but you do not intend afterwards to generalize your information to any other health service. But what you're interested in doing is looking at your health service in depth, maybe looking at why they're having very high testing levels, what the barriers are or the facilitators of high STI testing levels. So it's if it's well done, it provides a lot of in-depth information about a particular site or a particular area or a particular person. So you have to find what your case is and investigate it thoroughly. So that is a type of study, but it's not considered a very strong type of study. So the next level is cross-sectional studies. The strength is considered to be moderate or weak. Again, because you and when we compare that to randomized control trials, you do not have a control group that you're looking at in comparison. However, cross-sectional studies do allow you to examine the relationship between factors, and the factors could be, for example, between someone having a disease and other factors that they may have. But the reason why it's a weak study is because you're measuring the exposure and the disease at the same time, and it's difficult to know what came first. In our case, for example, we who are working in the STI field, we may want to carry out a study looking at the STI testing rates in maybe several primary healthcare services. But what we're doing, we're looking at the primary healthcare service and measuring particular factors at one point in time and looking at the STI testing rates at that point in time. So it can help us look at it analytically to see what factors are associated with high testing rates, for example. However, it's difficult for us to make any extrapolations, and that's why it's not considered a very strong study. Case control studies are the next one up, and the strength is considered to be moderate. In this case, you do have cases and controls, so you're comparing two different groups of people. And what you're looking at to see what factors may have been present in each of those groups. So what factors in the case group and what factors in the control group. Unfortunately, for case control studies, there may be unknown factors that we cannot measure or control for, but they're relatively less expensive to conduct. So for example, we may look at a site where there are very high testing levels. For example, maybe here in Western Australia, we may have health services with very high testing levels. And then we look at a control group where there are very low testing levels, and we measure factors in both groups. Case control studies are stronger than cross-sectional studies, but still they're not very strong studies. A cohort study, which is the next level up, is a moderately strong design, and it's an observational study. And basically in this case here, we are either following up people in time or following up a health service in time, though it can also be conducted retrospectively, sorry. And in this case, we're trying to follow up for example, if we're looking at development of disease, we're trying to look at two groups of people or whatever we're comparing and see how they develop disease in future. So again, a cohort study is not as strong as a randomized control study. However, it is stronger than the ones below it and possibly not as expensive as a randomized control trial. So a randomized control trial, which is the next level up, is considered a very strong study design, because particularly in this form of study, you randomly assign your participants and controls, and then you follow them up in time. By randomly assigning participants and controls, what you're hoping to do is to randomly assign your confounders, because whenever we are conducting studies, there are always factors that affect the outcome that we are not quite sure. So for example, it might be the age, the gender of a person or something which might affect the overall outcome. So by randomly assigning people into two different groups, what you're hoping to do is to also randomly assign the confounders, so that ultimately the only difference between one group and the other is your intervention. Because you're putting the intervention in one group and you're not putting the intervention in the other group. And you're trying to see what the outcome is at the end. So by randomly assigning people into two different groups, what you're hoping to do, as I said, is to randomly assign the confounders as well. And also, it's very important in your randomized control trial to have blinding, and blinding, and there are several levels of blinding, but what you're hoping to do in blinding is to ensure that the people who are assigning people into various groups do not know who they are. Because sometimes, as for example, as a clinician, you may think to yourself, when you're assigning people to do two different groups, you may think to yourself, oh, I want my patients to get better. So you put the sicker people in the intervention group. But it's very important that the people who are assigning people to different groups are blinded to knowing who is going into which group. And I give an example at the bottom. So the meta-analysis and systematic reviews are considered the strongest design of them all in quantitative approaches, because what a systematic review is basically doing is combining the results of several studies. Now, hopefully when you're doing a systematic review, you are combining well-done studies, and usually, Cochrane, for example, has always encouraged the use of, for example, randomized control trials, though over time they're considering non-randomized control trials as well. But what we are hoping to do in a systematic review is to combine data from various populations and hopefully come up with one value, which is, and this is what happens when you're doing a meta-analysis. Because a meta-analysis is basically looking at the quantitative outcomes or values that you've received in every individual study and combining it hopefully into one figure. So systematic reviews is really what Cochrane and other systematic review bodies are encouraging out there. And if one can do a systematic review, it's a very good skill to get as well. But they are considered the topmost source of evidence for studies. And usually systematic reviews is what drives guideline development. So as I said earlier on, the only quantitative method we'll talk about today is surveys. And last time we talked about what the common features are of qualitative research methods. And today we're going to talk about what the common features are for quantitative research methods. So in quantitative research methods, what we are doing is mainly hypothesis testing. We usually tend to have a fixed or priori design. And usually in comparison to qualitative research methods, sometimes those tend to be more iterative, where you don't have a fixed design from the word go. But with quantitative research methods, you must and usually have a protocol beforehand and determine what it is exactly you want to measure in both participants and control groups. The emphasis in quantitative studies is looking at whether or not there are causal relationships between the independent and dependent variables. And usually you can have, under quantitative research methods, you can have either experimental, pre-experimental, or quasi-experimental design. And experimental design is where you are, as I said earlier, when we talk about randomized control trials, when you have an intervention and you randomly assign people to two different groups. While quasi-experimental, you have a control group, but people are not randomly assigned. Usually you'd have probability sampling for your studies, but we'll talk about other sampling methods in a moment in quantitative research methods. And what your emphasis is in quantitative methods is an emphasis in removing the confounding factors. As I said, or controlling for them, sorry. So as I said earlier on, when you're doing a randomized control trial or an experiment, as we said, we do have confounding factors, but we don't want them to affect the outcome. So when we're doing the study, we try as much as possible to either randomize the confounding factors or control for them when we're doing our analysis later on. And usually with quantitative research methods, we put our, and we'll talk about this in analysis, we put our figures into tables, we summarize them in terms of numbers, while with qualitative methods, we summarize in terms of narratives or words. So talking about surveys, and some of you may use this, or you might have used this before in your past studies. A survey is a technique for gathering statistical information about people's attributes, for example, age or sex, or gender for that matter, their attitudes or their actions of a population by administering standardized questions to some of or all of its members. So basically with a survey, we are trying to collect information from a relatively large group of people, and we are trying to do it in a standardized way so that everybody is asked the same question. So that when we analyze later on, we're able to say something about the population that we have surveyed. We can have self-administered surveys, but usually this would be in the case where people have high levels of literacy. For example, in some communities, people may be able to fill in their own surveys, but in some populations, you may actually have to administer it on their behalf. We can have face-to-face surveys where you actually seated in front of the people taking down their information. Or you may have, for example, telephone surveys, which many of us have participated in as well. Or you may use online technologies as well. For example, people use SurveyMonkey, and Qualtrics as well are used as online methods of collecting data. And I think some people use something now called Redcar as well. So you should consider using surveys when you have a large number of program participants. So when you're interested in very large numbers, maybe 50, 100, 1,000 people, when your answers are required for a specific set of questions, and when you require information on a wide range of topics and in-depth detail is not necessary. So this is in comparison, for example, to last month when we were talking about using interviews. For example, an interview, you'd use it when you're interested in in-depth information, but a survey is usually when you're interested in more superficial or not very in-depth detail. So a survey can be used to describe or explain phenomena. And usually when we have a survey, we must remember to collect information about, first and important, the demographics, because later on you don't want to go back and analyze your data and you've forgotten to collect information about people's age or gender. So we can also collect information about people's behavior, their attitudes, beliefs, or opinions, their characteristics, their expectations, their self-classification, or their knowledge. So a survey is very good if you want to collect general information and a broad scope of information about the people you're surveying. There are different type of questions that you can ask. You can ask, do you agree, disagree, strongly disagree, and that sort of format. You can have like-heart questions where you're basically ranking or rating. You can ask people to fill in a blank, or you can ask people to answer in a narrative or open-ended form. However, the narrative or open-ended form would be analyzed qualitatively, but you can always add that onto your questionnaire as well if there is more information you want about something. However, we must be very careful when we're developing our questions for a survey about asking complex questions, asking double-barreled questions, and sequencing of questions where placement of one biases the answer to the next, or wording questions in a leading or biased way. So usually when, and we'll talk about piloting in a moment, but usually when you develop a questionnaire or a survey, it's important to send it out to people to have a look and be able to tell you whether or not your questions are well developed. Talking about the reliability of a survey, it's really, really important when you're developing one. And usually when people are doing studies, the general trend these days is actually to look out for a survey that the reliability has already been tested. Because if you create your own survey, usually, and depends on whether you're doing a master's or a PhD, but usually people may ask you that, have you tested the reliability of your survey? So sometimes people just find surveys that have already been created. Reliability refers to how precisely the survey measures what it's supposed to be measuring, and any survey that has low reliability has little meaning and is relatively useless. So you basically, if you've collected your data, you can't rely on the information that you've collected because your survey wasn't reliable. And usually when you're using someone else's survey or developing a survey of your own, what you're looking for is whether or not it's highly reliable, and that is if the reliability has been measured, whether it's 0.9 or higher, that means it's extremely reliable. But if it is 0.5 or low, it's basically an unusable survey. So what you're looking for, if someone tells you they're giving you their survey, is to look at this rating to see where it is on this scale. So, as I said when we were discussing last week, everything has its strength or weakness, and with a survey, it's best if you do not know much about your topic and it's very much exploratory research. Maybe it's not good to use a survey. It might be better actually to do qualitative research instead, and then develop your survey later on based on what you have found from your qualitative research. So if you don't know very much about the topic and it's very much still in an exploratory stage, consider not using a survey. If you're trying to uncover very long past behaviors and people have to recall very hard about what they did 5 years ago, possibly might not be very useful to use a survey. If the area is very, very sensitive or very complex, and if you want to detail contextual information about something, also maybe consider not using a survey as well, and consider using an in-depth interview might be a better method to use. And if your unit of analysis is higher than the individual level, so for example, you may be more interested in doing, if you're doing STI testing levels, you might be more interested in looking at the health service level than looking at the individual level per se. So consider using other methods if a survey is not very helpful. So just the strengths and weaknesses of using a survey. The surveys are good for collecting descriptive data, can cover a wide range of topics, and if your respondents are motivated, then your response rates are likely to be high. And in this day and age where people don't want to respond to surveys because people feel they're over-researched, think very hard about whether or not to use a survey if you think your response rate won't be very high. However, they are susceptible to reporting biases. The data that you get from a survey provides an overall picture but lacks depth. It's not very useful if your topic area is sensitive or it's very complex, and it may not, as I said earlier on, may not provide information, a lot of information about context. So when we talk about mixed methods, it's usually good if you want to still use your survey, it might be good to mix it with qualitative research methods if you want more in-depth and contextual information about something. So last month we talked about sampling methods in qualitative research, and again you also have sampling considerations in quantitative research as well, because basically what sampling does is that it allows us to collect information on a smaller group of people, which allows us then to extrapolate it to a larger group of people. Because sometimes in some cases we can't collect information from everybody. So what we are looking for in quantitative research is to collect information from a smaller group of people, which is hopefully representative of the larger group of people. So they are on the left-hand side, the types of quantitative sampling, because last month we talked about the qualitative sampling, which was on the right-hand side. So as I said, in quantitative sampling, we are hoping as much as possible to have a group of people who we collect information from that we can then generalize to the broader population. And that is best if you do probability sampling. So on the left-hand side, we have, on the extreme left, we have probability sampling methods. So we have simple random sampling, stratified, cluster, and systematic sampling. Under stratified, we can have either proportionate or non-proportionate sampling methods. On the right-hand side for quantitative sampling, we can also have non-probability sampling. And under that, we have convenience, quota, and purposive sampling. Now, the problem with non-probability sampling is that when you collect information, so for example, with convenience sampling, you may be standing at the supermarket and you're just collecting information from everybody who comes through the door. The problem with that sort of sampling is that you cannot then generalize, you can say information about the group that you've collected information from, but then it's very difficult for you then to extrapolate that information and say that I collected information from 400 people and it says information about the 4,000 people, for example, in Geraldton. So when you do non-probability sampling, basically what you're doing, you're basically collecting information from people who you can conveniently access, but then it's very difficult for you to extrapolate that information to a broader population. In probability sampling, everybody has, in general, everybody has an equal chance of being selected to be part of that study. So for example, in simple random sampling, and they're all generally similar in that sense because everybody has an equal chance of being selected to be part of that study. However, with simple random sampling, what you're doing is that you have, for example, if you are sampling people from a school, for example, and you have maybe 10,000 children in the school, and you want to have, you've calculated your sample size to be about 1,000 children. So you're not going to talk to all the 10,000 children, you only want 1,000 children. So of the 10,000 children, every child has a chance of being sampled. So they have an equal chance of being within that group. So then you use a simple random sampling method to get 1,000 children out of the 10,000. With stratified, which is slightly similar to that, but in stratified, what you would do is to get those 10,000 children and break them down into class groups, for example. So you stratify maybe year 1 to year 2, for example, year 3 to year 4, and then you do a simple random sample from each of those groups that you've broken down the people, so that everybody in year 1 and year 2 have an equal chance of being sampled into that study. And then ultimately, when you get your results, then you're able to extrapolate that information that you've collected to the broader group of people. So that's what the difference between probability and non-probability sampling. So just really quickly about analysis with quantitative analysis. There are two types of data that we collect when we are doing quantitative studies, and we group them into categorical and numerical data. Under categorical, we have nominal data. So the data has no logical order. So for example, male or female, while ordinal data has a logical order, but the difference between the values is not constant. For example, medium, small, medium, and large. With numerical data, the data is continuous and has a logical order, and the data has standardized differences between your values. And they have two types of numerical data, which is interval data and ratio data. Interval data does not have a natural zero, for example, Fahrenheit scales, and ratio data has a natural zero, for example, height, weight, length, and age. Now, usually when we collect data, what the general advice to do is to collect your information in numerical data, if you can, and then convert it to categorical data later on. So for example, ratio data in particular, you may instead ask people what their actual height, weight, and age are. Then later on, you can convert that to categorical data and, for example, put it into nominal data, you can call it 0 or 1 if you, for example, have people above or below the age of 30, or you may convert it to ordinal data. So the general trend is, if you can, collect it, your data as numerical data, and later on convert it. But of course, there's some data which is already categorical. You cannot collect it as numerical data. So just be aware of the different types of data you can be collecting as you're developing your surveys. In terms of analysis, the analysis, of course, that you do will depend very much on the data that you have collected. If you've collected categorical data, you summarize those as frequencies, for example, percentages and proportions. So the percentage of women below the age of 30, for example, maybe that would be about 30% or otherwise. And you present that in form, or you can present that in various ways, and you can present that as a bar diagram or as a pie chart. Your numerical data will be presented in form of means, and if you present a mean, you should show also what the standard deviation is. You can present your data in terms of minimum, maximum, or median, and if you have a median, you should have the interquartile ranges, and numerical data can be presented in histograms or frequency polygons. And that is just describing your data. When later on, you can go to the next stage of actually comparing your data. So for example, you can compare your means, you can compare your proportions, or you can compare several means. So for example, giving an example of comparing your means. If you've done a study, and you've, for example, done a study among children, for example, and maybe it was a nutritional study, and you had one intervention in one group, and you had a control group in which you didn't have the intervention, you may want to compare the mean weight or the mean height over time. So in that case, you'd be comparing the means of two different groups of people, and you'll be using the t-test. Or you may be comparing proportions. So you may still have a similar study, and you're looking at the proportion of young people who smoke, for example. And if you're comparing proportions, in that case, you'd use a chi-square test. And then another level of analysis, you can do a correlation, which you're comparing two continuous variables. So for example, you may be comparing, for example, weight and height, for example, that's just an easy example, or weight and blood pressure. Or you may be doing a linear regression, or you may be doing a multiple regression. And a multiple regression is basically where you put various variables in the model, and what you're trying to do in that case is to control for confounders. So what I've done there is I've provided, and if you can't have access to them, let me know, I'll send them through. Very simple, easy readings on statistics that, especially for those of us who are just starting out, will find them very helpful in trying to describe the way different statistics are done. So basically what I've said is more elaborated in these papers. Particularly the first paper is a very, very easy read. So Louise can send those out later on. So we've completed the discussion on quantitative research methods, and so I'll just quickly go over data management, ethics, and other topics. So please remember, when you've collected all your data, that it must be well stored, and you must think very hard about storing both your electronic and paper information. And especially if it's on computer, you should have computer passwords, and usually at universities, you would have a computer password, and your computer, for example, if you leave your office, logs out after a while, so then prevents other people from coming into your computer and finding other people's data. It's important to have to keep your code sheets if you have them, and also your de-identification. So for example, if people have put their names on the questionnaires, or for example, in fact, you would not want to have their names on their questionnaires, but you'd want to have a number which identifies them, you must make sure that the questionnaires and the sheet that identifies who they are not kept together in the same place. And of course, your data is, you hopefully lock it away in your office. That's the paper data. In terms of backup of data, it's important to back up your data in case your computer crashes. A lot of us have been able, you can get them either through your university or otherwise. You can get a hard disk where you back up your data. But the important thing is to make sure that that data is not, that hard disk also has a password or encryption so that nobody can access your data. Some people have data dictionaries. I'm not sure if the CRE has one, but another project I work on does. And basically what a data dictionary does is it explains when you're putting your data into SPSS or whatever database you're using, it explains what your code stands for, and I can send out one later on so you can see an example of what a data dictionary looks like. It's very important when you're managing your data to remember that sometimes the data that has been inputted into your questionnaires might not be very clean, or when it has moved from your questionnaires into your database, you may have to go in actually and make sure that the data that is entered is clean and that there are no errors which were entered when people were entering the age groups. Some people use Excel, for example, to do that sort of thing to make sure their data is clean, but you can do that in other packages as well. So for example, if people have entered age groups and you don't expect to see a 99-year-old in your database, you may go and look at just the ages and analyze and make sure that, or you don't want to have a person with 0 years old in your database. You'll be able to look at your data and see where the errors have been entered. So there are several methods of doing that. And one of them, for example, is just doing a simple histogram. If you do a histogram, and then you'll be able to see where the outlying errors have been made. So in terms of communication, communication is one of the essential parts of our research work. And usually what is expected, of course, is that there will be communication during and after your project, not waiting only until after the project has ended. People these days use websites, and I think the CRE has a website as well in order to communicate how research is being conducted under the CRE. But I know quite a number of people also use Twitter, Facebook, and other methods as well of communicating, not only to the team with which you're working, but also to your participants and others. There are several ways in which we communicate, and usually people only think about peer-reviewed publications, but other people can write reports as well. But also we can, and I know quite a number of people like to write 2-page simple products for especially people who are lay or who are not high-level researchers, so they can also know what's going on in the project. And people, of course, do face-to-face or webinars as well. People use conferences, both national and international, but people also use webinars as we do in order to help communicate. But the important thing to remember about communication that's appropriate to your audience, and because as much as possible, we're trying to relay information. And if, for example, some peer-reviewed journal articles are not what the ordinary lay community people would want to read. So it's appropriate. We have to remember when we are communicating to scale our communication to the audience with whom we are relating. In terms of ethics, and you did talk about ethics, I think it was Stephen who talked about ethics. And Claire talked about ethics a while back. It's important for all our research that ethics approvals are done before the research starts and not while it's starting. And the NMHRC in particular is very strict about this. And in fact, if they find out that you've done your research before ethics was approved, they can actually pull your grant. It's important to know who your committees are in the state and health departments as well, and also the Aboriginal ethics committees, particularly in WA, we have WAHAC here. And in WA, we also know, and I think Claire knows it, that when you get ethics in WA, if you want ethics that covers the Kimberley, you have to get ethics approvals or approvals in general from the Kimberley committee as well, research committee. So be very much aware in your state who you have to ask permission from. Make sure you take note of the meeting dates. So for example, in WA, we have to make sure that we check when the meetings are held. So, for example, no meetings are held in general in December and January. So, if you know you want the study in February, it's possibly better to get your ethics approvals in October or November the year before. So, be aware of the ethics meeting dates for whichever committee you're submitting to. It's very important, especially in our work, to address the Aboriginal and Torres Strait Islander criteria when we're developing our ethics approvals. And remember, for some universities, sometimes people give reciprocal approvals. So, for example, in UWA, once you've got approvals from WEHAC or other research committees, all you have to do is to inform our university that you've already received approval, and they give immediate reciprocal approval. So you do not have to resubmit another approval process to UWA. So for us, actually, in UWA, when we want to do our studies, we first deal with WEHAC, and once we've got WEHAC approvals, then we know UWA is much easier to get, because they won't reassess it because it has already got approval from somewhere. And I hope that's the case with other universities as well, because that makes ethics approvals much easier to get if your university gives ethics approvals. So just really quickly about the budget. Sometimes when we're developing budgets, there are many things that we forget to put on the budget. And usually, for example, if we're doing work up in the Kimberley or in other remote areas, there are certain things in particular you must consider when you're putting in your budgets, as compared, for example, if you're doing the research in Adelaide or Perth. So think very hard about the staff salaries that you want to put in, including on costs and annual increments. Because, for example, if you're going to hire people over several years, you have to remember that there will be annual increments that you have to factor in, and you have to factor in, as I said, on costs as well, like annual leave and other things. Equipment, including computers, venue hire, meetings and teleconference as well need to be paid for, and usually your universities or otherwise will not pay for them. Think very much about car hire, and as I said, in the Kimberley, you have to think very hard about car hire, which tends to be much more expensive. Think about interpreters, especially if you're going to be working with communities where you need them. Think about funding for training, data management as well. Particularly if you're doing qualitative research, you probably need to pay some transcribers to do your work. And you can find quite a number of transcribers who will do your work much more swiftly than you do, and that can take a lot of work off your hands. So if you need to factor in transcribing as well, do put that into the budget. Very important in our work to put in budgets for feedback to participants. Particularly, you may want to fly back to a remote area or something like that to feedback to your participants, and you factor in flights and car hire and all that sort of thing. Don't forget to put in consumables. And for some budgets, it's also important to work in your in-kind costs so that people are aware about the full cost of your study. It's not just the actual costs that we see that are visible, but then there are a lot of in-kind costs as well that sometimes we have to highlight. So there are several funding bodies. A lot of us know, of course, about the NMHRC and the ARC, which generally are hard to get in. I think about only 20% of grants get funding under the NMHRC. So just be aware that there are other sources as well. For example, state funding. Check your universities as well, because sometimes you can get funding from your universities. So for example, at UWA, we have one called FAGALE. And I got that one about 2 years ago. And especially us in this field, and people, some of you who are working at the core phase, working in difficult areas and far areas, some of these grants are relatively easy to get, especially if you emphasize how difficult it is and all this sort of thing. So when I got my FAGALE, I talked a lot about how I'm in remote rural Australia. It's very hard to get training opportunities in Geraldton and that sort of thing. And I got the top level of the FAGALE, because usually people get low amounts, but I got the top amount, and I was able to go to Canada for knowledge translation training. So if you're out in the field, just be aware that there are grants that really cater to people who are in difficult circumstances like we are. But also know that there are other non-for-profit sectors. So for example, when I was doing my PhD, I applied to the National Federation of University Women in South Australia. So not even WA, but South Australia. And I got $6,000 for funding for my PhD. Now I think they're now called the Australian Federation of Graduate Women. So it's no longer AFUW. And so those are other ways in which people can get funding as well. I don't think they only support females. I think they support males as well. But those are other areas where you can also get funding other than the NMHRC. And just remember, with the NMHRC, you can get funding for projects, but also funding for your salaries. And I'm not sure about some of our PRPs, but they may actually consider getting scholarships or otherwise through the NMHRC, and we can talk about that another time. So we're about to come to the end. So talking about research teams, it's really, really important to be inclusive and collaborate. A lot of times, when a lot of us started out as researchers, we started off as individuals. You're doing your PhD and you're basically working by yourself. But I think more and more, it's very important to work with other people as well. And if you're a PRP or someone who's lower down the rank, the best way to get into a collaboration is to offer yourself to be of help, because a lot of times, a lot of the researchers are very busy and that sort of thing. So if they see a young researcher putting up their hand and saying, I want to be part of this collaboration, I will help with the systematic review, or I'll help with the groundwork and that sort of thing. That is how you get into collaborations over time, because they are sometimes hard to crack into. But being of use, I think, is one way that young PRPs can get onto the ladder. When we're thinking about a team, think hard not only about your investigators who are on the team, but think about data managers, think about your study manager, because those are essential part of the project. And sometimes if you're doing your PhD, you end up being one and all. But if you're working in a larger team, these are sort of people you'll be thinking about. So research assistants, statisticians and epidemiologists, people who help you with communication, because not all researchers are good communicators. Not many of us have been trained in that. You may be thinking about community leaders as well, cultural advisors, as well as community representatives and health consumers. So if you have a relatively large team, these are the sort of people you'll be wanting to be on your team. And it's important for helping, not only to help attract and refine your ideas, but also helps a lot in funding. And the NMHRC likes to see, especially if you have community members, and if you have an Aboriginal project, if you have Aboriginal members on your team, gives you much more strength for your study. So please remember, when you're doing research, to get advice early and continuously. For the team, again, I just put here the more the merrier, particularly if you include key people on your study. Do not include people for the sake of including them. Think very hard about who you want to be on your study. In terms of methods, and I'm talking about the survey in particular, if you don't want to use your own survey, think about using others that other people have used, and it saves you time and need for validation. Be very patient, particularly in the beginning when your ideas are forming, because usually what we think is, as I said in the first session, what we think is important might not be necessarily important to other people. So be patient with yourself and be patient with other people when you're developing your ideas, because eventually when you come up with your idea, it will carry you on for the next 3 to 4 years. But be very patient with yourself, particularly in the beginning. Very importantly, bring your research in line with state, national or university priorities, as it helps in getting funding and draw attention to that in your proposal. So for example, when I write, I tend to look at what the national strategies are around STI testing and sexual health, or BBVs for that matter. And I even write that into the proposal. I say, for example, the national state guidelines say that this is actually a priority. so that you're able to draw more funding in if people think that your idea is part of a larger issue going on in the country, and not just your idea which you thought about in your health service or your hospital. So think very hard when you're writing your ideas, to think what are the national and state priorities, and how does my work fit in with those. And even within our CRE, how does your project or whatever tie in with the CRE priorities. So these are just some resources, particularly for people who are interested in mixed methods research. Tedley and Tasha Corey is a very good resource. For us who are researching, particularly in this area where a lot of our people are vulnerable, the second resource is a very, very good resource. When I was doing my research back in Africa, it really, really helped me think very hard about the people I was working with. And because a lot of people we're working with are vulnerable for various reasons, and this gives you a good guide around that our research, particularly in this area. And I've just given you a few more resources, particularly on focus groups, lit reviews as well, and I have more if anybody's interested. And the bottom one, which is the research training program in WA, is a very, very good online resource if you want to learn more about research methods in general. So all you have to do is to sign up for an account and sign in if you're interested. So that brings us to the end of the 2 sessions on research methods and fundamentals in general. I haven't covered absolutely everything, and a lot of stuff I've skimmed over, but really what that was to do was to just give you a general idea of the general research methods which are out there and other resources that you can access as you develop your research ideas or continue as researchers into the future.